Amen and amen.
Celebrations. Liquids. Next to air, water is the most vital element needed for survival. Every day, intricate processes within your body use water to keep you alive. In fact, humans are about 70% water, which clearly shows that water does much more than just quench thirst. Studies show that water is the transport system within the body, the facilitator of digestion, a temperature regulator, a major constituent of the circulating blood, and a lot more. Clearly, water is the liquid of life. But how much water do we really need to stay hydrated and enjoy its benefits? In a healthy person, the rule of thumb is to consume enough throughout the day to ensure that the urine is clear. Begin your day by drinking water, because your body will be relatively dehydrated after sleeping. Then keep drinking water at regular intervals throughout the day. Staying hydrated is key to good health. Life couldn't exist without water. All your body functions require it. Water cleanses, refreshes, and powerfully aids your body's restoration.
Hello, everybody.
We are Hosanna Praise,
And we are inviting you
to join us at the 5,
4,
3, 2,
1.
Countdown to the End Evangelistic Series.
with who? With Evangelist Dr. Shian O'Connor, beginning March 3, 2024.
And where will this be?
Under the big white tent, Municipal Boulevard, right across from the JUTC Depot, Portmore, St. Catherine.
See you there.
Oh,
We have come with open hearts. Oh, let the ancient words impart.
Welcome back. And as our celebration video says, water is very important. So I'm hoping while you are viewing, you have your water with you this evening. In our Did You Know feature, did you know that male children are more likely to have asthma than female children? This trend reverses in adulthood, where female adults are more likely to have asthma than male adults. Did you know that? Did you also know that among children ages 5 to 17, asthma is one of the top causes of missed school days? Did you know that? Did you also know that adults are 6 times more likely to die from asthma than children? Female adults are more likely to die from asthma than male adults, and the risk is equal among male and female children. Did you also know that Black people in the US are nearly 3 times more likely to die from asthma than white people in the US? Food for thought. Well, our guest is a consultant anesthetist, intensive care and pain management specialist. He is the senior medical officer for the Mandeville Regional Hospital. He is a member of the Northern Caribbean University Church and actively serves as the Prison Ministry Director and Assistant Health Ministry Director. Ladies and gentlemen, we welcome Dr. Everton McIntosh to Your Health and You this evening. But before he joins us, however, remember to post your questions in the chat. We want to hear from you, and I'm sure Dr. Mac wants to answer your questions. So please post your questions in the chat. After this brief message, we'll be right back with Dr. Mac. Stay tuned.
The American Heart Association has identified sugar-sweetened beverages, or SSB, as the primary source of added sugars in the American diet, contributing to the pandemic of obesity in our country. SSBs are also linked to insulin resistance, impaired B-cell function, and belly fat, precursors to metabolic syndrome and type 2 diabetes. In addition, recent studies have found that these beverages increase inflammation, which contributes to arteriosclerosis, plaque stability, thrombosis, and risk for heart attack and stroke. That's a fact. But there's hope. God gave us a perfect beverage that does not promote weight gain or chronic disease: water. It has no calories or additives and is widely available, inexpensive, and generally safe. So, do your health a favor. Go pour yourself a tall glass of God's perfect beverage.
All right, welcome back. I know you're waiting patiently. Welcome, Dr. Mack.
Thank you. Thank you for having me. It's a pleasure.
Wonderful. All right, so we're not going to keep our family waiting. Those online are waiting to hear about asthma, so we'll get right into it. What exactly is asthma, Dr. Mack?
Asthma is a very common chronic condition. It's actually an inflammatory disease of the airways. Now, the airways is a portion that takes air from outside down into the lungs. Okay, so asthma typically affects the lower airways, what we refer to as the bronchi and the bronchioles, the smaller ones below the trachea. Okay, and so it is characterized by what we call reversible airway obstruction. That is, it prevents air from flowing freely as it does in normal persons. So during an asthma attack, there is a constriction of the airways, which especially during expiration, when you breathe out. And so typically the asthma patient has difficulty emptying the lungs. Once they have inhaled, they have difficulty getting the air out. And so they have to make a greater effort. Under normal conditions, breathing out is what you call a passive process. It doesn't require any effort on your part. The effort is really in breathing in, where the diaphragm goes down and the chest expands. But expiration or breathing out is a passive process. However, in asthma, because of this, the increased resistance to airflow due to the narrowing of the bronchi, you know, have to use what they call the accessory muscles of respiration to try and squeeze the air out of the lungs. So that makes you have to work harder to breathe. If it's not corrected, you can actually develop what they call respiratory muscle fatigue. You just get tired.
Yes, because of all that energy that it's exerting to get the air out. And that's why we hear this sound that we call wheezing.
Right. So the characteristic feature of asthma is really the wheeze. So this wheeze, it's heard typically, like I said, when you breathe out. So usually when you breathe in, there's no problem. But it's when you're breathing out now, you hear that. Remember in the olden days, I don't know if they still have them, fee-fee.
Yes.
So you get that high-pitched whistling sound.
Right.
Which is a wheeze. And so that's a typical symptom. But you also get coughing and, of course, difficulty breathing or shortness of breath. You know, person may breathe a bit faster than usual. And so these are the typical symptoms, you know.
Do you have different types of asthma, though?
Yes, asthma, there are different ways that people have classified or categorized asthma.
Yes.
One classification is based on, the causative or triggering agents. So you can have, for example, allergy-induced asthma, where the attacks are triggered by some kind of thing that the patient is allergic to. You can have aspirin-induced asthma, where they take aspirin or similar drugs like what they call the NSAIDs that can actually trigger asthma in those patients. There's a variant that is called a cough variant asthma. All that means is that the person, when they get an attack, there's not much wheezing, but they tend to cough more. Actually wheeze. So the absence of wheezing doesn't mean that a patient is not having asthma. Okay, that in some persons they may cough more than they wheeze. Then interestingly, there's an exercise-induced asthma. There are those persons who love to work out, they go to the gym or they go jogging and so on, and they develop asthma attack as a result, Some persons get asthma attacks at night, so you call it nighttime asthma. They're fine during the day, but at night they wheeze. And yet this may be related to exposure to the cold temperature when temperature drops at night, and so on. All right. And then you may talk about like occupational asthma, where persons in certain occupations, and this has to do with exposure to various things at the workplace, maybe a chemical, dust, or whatever, depending on the patient's occupation. And
right.
So that kind of what they call occupational asthma.
Yes.
But you can also look at this in terms of the severity. So there are some persons, for example, where they get the occasional attack and in between they're perfectly fine. So that is called that is called intermittent asthma.
Mm-hmm.
So, but then you can have the persons who, because asthma, as we said before, is a chronic condition. Chronic means you have it long term. So it's not something that you have and you get better and that's it.
Right.
You always have it, and so you have to keep that under control. So there are some person then we have what you call mild persistent asthma.
Mm-hmm.
So the attacks, when you get them, they're mild. Whereas there are some persons who may have what they call moderate and others with severe persistent attacks. All right.
Mm-hmm.
Now, when you get the acute attacks, that can also be classified according to the severity as well. So you have what's called acute severe asthma, then you have life-threatening asthma, and then you have near fatal asthma. That is where, within a matter of minutes, if action is not taken, a patient can die. So fortunately, there are situations where a person will stay at home and they're using their pump, they're not getting better, and they continue trying to use that. And it's when they are at death's door, when it's, really start to collapse, that's when they are rushed to the hospital. And oftentimes they don't make it, So that is something that people have been mindful of, So life-threatening asthma, near fatal asthma is situations where the attack is so bad that you have extreme difficulty breathing. The person might be sweating, they're extremely distressed, they cannot speak, or if they can speak, they're speaking, halting sentences. They can't take in a full sentence and so on.
Right, because they have to be taking these breaths in between.
Right. And the worst thing is, if a person starts to become drowsy, that is a dangerous sign. That is a sign that the patient is now basically decompensated. They can no longer manage. And the next thing that will happen is that they're just going to just stop breathing. All right.
Oh, gosh. Wow.
So you need to get the patient to help before that situation develops.
And I suppose you can develop asthma at any age?
Yes. For example, my mother developed asthma in her old age. She was about 60 when she started having symptoms. At first, we didn't know what was going on. Took her to national chest, and she has been getting nebulized, and all of that. So she had asthma.
Right. So what causes asthma? We know about the triggers and so on, but how it happens? Where it come from?
To be honest, we still don't know a lot about what causes it. We know that there is a genetic predisposition.
Right.
If your parents or first order relatives, like siblings and so on, if they have asthma, the chances are maybe 5 or 6 times more likely that you will have asthma as a child.
Yeah.
There's a thought that it may be due to exposure to some of the same triggering agents, allergens, irritating substances, and so on, or even viral infections. At one point, they were talking about, for example, a person who drink milk. Mother drink milk during pregnancy, or give the children milk. Talking about cow's milk.
Yes.
They are predisposed to the development of asthma.
Yes.
But all we know is that there is a genetic predisposition.
Right.
And so, for some reason, the airways become what you call hyperreactive. All right, so they are very irritable. And so the normal person, when you're exposed to certain things, nothing really happens. But in an asthmatic person, for example, even the slightest amount of dust in the ear. So, for example, my mother once she came to visit us, and she was complaining that there's too much dust. And I said, "What dust?" There was a house being constructed beside ours, but we living there didn't notice anything different in the house.
But she being asthmatic.
The small dust particles in the ear would have irritated her.
Yes.
Well, yeah. So these are, yes.
Is every wheeze as a result of asthma?
That is a very good question,
Yeah.
Right.
Or can people wheeze and not have asthma?
Right. So the characteristic symptom of asthma is wheezing, but not every wheeze is asthma. And especially in children, for example, you have to, and especially if they did not have a previous history of asthma. So if a child comes present with wheezing for the first time,
Yes.
then you have to consider, one of the things that you have to consider is the possibility of a foreign body. Aspiration of a foreign body, like a pea grain or peanut or something that the child has aspirated into the lung.
Okay.
Because oftentimes that is how it presents with the child wheezing. So and again, it's an unfortunate situation where oftentimes a child will have a foreign body in the airway, but they will go to a doctor who didn't think of that or missed it for whatever reason, and they're being treated for asthma with nebulizing and so on, not getting any better, and until they end up in hospital and the diagnosis is made. Sometimes, the result is not good because of a late presentation.
I can imagine.
Yeah. But the other things now, for example, in adults now, you have to consider things like, for example, congestive heart failure. Persons with severe heart failure can actually wheeze as a result, because their airways now are narrowed, not because of inflammation, but because of the excess fluid in the lung, which causes swelling of the airways. Wow. And so that is actually referred to, well, at least in the olden days, as cardiac asthma. And in the same way with shortness of breath and wheezing and so on. But they would have the typical history of having congestive heart failure in the past or have risk factors for heart failure.
Okay.
And so that really be sufficient to tip the doctors that they are probably dealing with not asthma per se, but a person who is now severe heart failure.
Okay.
But there are other things that, for example, you ever heard of GERD, gastroesophageal reflux disease? Yeah, so that is another thing that can cause people to wheeze at night. But when they lay down and the reflux up into the top of the throat, that can actually trigger wheezing as well. And so there are several things that can present with wheezing that is not necessarily asthma.
Okay. I see a question here.
I also mentioned COPD is a very important cause. So in the elderly folks, typically they're over the age of 60. COPD is a spectrum of disease that include things like chronic bronchitis and emphysema and so on. Usually due to long-term cigarette smoking, where the cigarette smoking actually damages the lung and causes them to develop COPD. And the typical symptom is usually severe breathlessness, and they may have wheezing as well. What the main difference with wheezing now and that their symptoms is that COPD is a progressive disease, as asthma, which is reversible. So the patient with asthma who presents, you treat them, and if treatment is effective, then they can actually return almost or usually back to normal. Whereas with COPD, all you can do is really ameliorate the symptoms somewhat, but you can never really get them back to normal. And over time, they will continue to get worse.
Wow.
So what you call respiratory cripples.
So what do you use to treat asthma? How can asthma be treated?
All right, probably the most important aspect of treatment is really patient education.
Okay.
Patient has to understand what asthma is and that it's a serious condition and that they need to take it seriously.
Yes.
Because we see patients who come in and they die because, and I gave some examples before, they didn't really take it seriously enough. So they have to understand the condition, and they need to take measures, to prevent themselves from getting these acute asthma attacks. So we're talking about avoiding the triggers. So the allergens, for example, and often there are things in the house like what they call pet dander, that is the little bits of hair and skin cells
and so on
of your cats and dogs and so on in the house. So they are there, maybe in the carpet, in the settee or wherever, and they're circulating the air. All right, and even things like roaches and other insects, the things that come off them can circulate in the air. You can't see it, but it's there. Okay, those can cause allergies. Plant pollen. So especially in the spring months now, when
springtime, yes,
when there are all these nice flowers and so on.
I tell you,
yeah, you find that persons will have. This is one of the causes of what they call seasonal asthma.
Yes,
in that time of the year where they have a lot of pollen circulating in the air. Right, so you have to learn to avoid those things that trigger your asthma. One of the things that especially if you just develop asthma, you have to try to identify what are your triggers. Because for everybody, it's different. It could be cigarette smoke, dust, certain kind of dust, paint, or anything like that. Anything that has a strong odor, a strong smell can trigger. All right, so you try to avoid those, and that will go a long way in helping to reduce the frequency and severity of your attacks. Now, in terms of medications, your doctor will put you on. There are two types of medications that are used typically. So one is the reliever medication. That is the one you take if and when you develop symptoms, acute symptoms, so you're wheezing, shortness of breath, and so on. That one you must always have in your possession, whether in your pocket or in your purse or somewhere, right? Because when you start to wheeze, you need to take it immediately. You don't want to wait. You don't have time to say to go back home and get it, because you may not make it home.
Mercy.
You don't have it on you and you start to wheeze, and the best thing would be to go to a health facility. All right.
Okay.
All right. So the other one now is the preventive medications. Okay. And these are what I'm talking about. Are the inhalers, because the treatment for asthma is for the most part is done by using inhalers. Okay. So the preventive inhaler is usually some kind of steroid, right? Persons tend to have a negative connotation, a negative impression when they hear about steroids.
Oh, yes.
Steroids are a powerful anti-inflammatory agent. And remember, I said that asthma is an inflammatory airway disease. The hallmark of asthma is airway inflammation. So medication is something that you take every day, regardless of whether or not you have the symptoms, all right? And the only time you come off it is if you go to your doctor and say, all right, you can come off it now, and we see how you do without it. But you should not stop taking it by yourself. A lot of persons make the mistake because they have been fine for weeks or months, and they say, oh, I don't take it anymore, and then they develop a flare. Okay, so you have to continue that. That is basically to prevent you from getting these, because you're always going to be exposed to the triggers. Even though you will try to avoid them, but you can never completely avoid the triggers. Because even emotions can sometimes trigger an asthma attack.
Are you serious?
Yeah. Anxiety, fear, and so on. Yes.
Like you have a panic attack or something?
Yes.
Okay.
All right. So you have to ensure that you take your reliever constantly and don't stop. Yeah.
All right. So I know. So what's the difference now between the inhaler and when you go to the hospital and you're nebulized? Because I know they nebulize you as well when you have asthma, right?
Right. All right. So your rescue inhaler, people use different terms for it. The rescue or the reliever, the one that you take when you get an attack. When you press each time you press it, you get they call it a metered dose inhaler. So each time you press it, you get a set dose of the drug that is delivered into your airway. One of the things about it, though, that persons have to be able to use it properly.
Right.
A lot of persons, they say that the inhaler is not working, but when they check it out, it's the fact that they are not using it properly. Okay. So they have to be taught. So when the doctor give it to you, they should really teach you properly how to use it.
Yeah.
So when you go to the hospital, if that is not working, then is a similar medication they're going to use to what you call a nebulizer. So they think that is connected to the oxygen, and they turn it on and they're making that sound, and you see the mist come up in the mask and they put it on your face. All right, it's a similar medication. All right. The advantage of that now is that it can be given in higher dose, and which will be more effective. For the pump that you use on your own, you don't want to give it too high a dose, because after a certain amount of dose, you need to be on proper monitoring. You should be properly monitored, because there can be side effects. All right.
Okay.
That class of drugs, they're called beta mimetic drugs, which they have side effects. For example, they call the heart to race and the blood pressure to go up and so on if the dose is above a certain amount.
So how many times can you use that inhaler before you have to head to the hospital?
If you use it 3 or 4 times at the most and you're not seeing a difference, you really should head to the hospital. Okay. Usually, if it's working, you'll get relief immediately. Like within a matter of minutes. And so if you if you use it once, use it twice, use it a third time, and you're not seeing a difference, and you really ought to go to the hospital and don't wait around.
Okay. So that would follow to my next question, because, sometimes we like to watch things at home. So you're having an attack and you're trying the inhaler, maybe it's not working or you're not doing it properly. At what point should you say to yourself, I need to go to the hospital now? Or you see a relative or someone having an attack. At what point do we say, no, you need to go to the hospital now?
Yeah, so as I said before, if it's not working, if there's no response, if you're not feeling any better after using it a couple of times, then it means that you need to try something different. Because sometimes you may actually need a higher dose as what can be delivered by nebulization. Sometimes you may actually need a different medication, which they can deliver at a hospital. Some person may actually need to get an injection of steroid. All right. So the steroid that you have in the preventer medication would not be strong enough to avert an attack. So when you go to the hospital, they'll actually give you an injection into the vein of steroids to counteract more rapidly counteract the inflammation that is there and help with the response to the nebulizations. Right? So sometimes that is necessary. The warning signs for severe asthma or for asthma which is near fatal and stuff like that. I think I mentioned it before, but just to reiterate again. So if the patient is having extreme breathlessness, so they cannot speak to you properly, they're counting their words. They have rapid respiration.
Right.
If you look at their straining, what we refer to as signs of respiratory distress, where you see use of accessory muscles. So like the muscles in the neck, people call them veins or string, but they are not. They are muscles. They get very tight and very, very prominent. Usually a sign of extreme effort in breathing.
And you see mouth breathing, nasal clear, nose.
Right. And if it starts to sweat, the sweating is an indication of severe distress. It means that it's not just a matter because of working hard, but sweating is a cold sweat, which is due to activation of your sympathetic nervous system, right? Which happens when you are under extreme stress, and if the patient now starts to feel tired, they say, boy, I'm feeling tired or anything like that. And worse, if they start to get drowsy.
You spoke about that, drowsy.
Drifting off. That is a dangerous sign. All right, that means that you just drop what you're doing and rush them to the hospital right away. All right. Worse also is if so they were wheezing all along, and then after a while you don't hear anything. They stop wheezing. That doesn't mean asthma getting better.
Has resolved.
No, that's not resolved. All right. So they have what we call a silent chest. Okay. And that is a sign where you get respiration muscle fatigue. So they can no longer fight to overcome that resistance. Okay. And so because of that, the amount of airflow going through the airway is so small that it's no longer audibly, can no longer hear it. This is another extremely dangerous sign. That means that this person is going to die sometime within minutes. And so you don't really have a lot of time to play with. You need to get them to hospital
immediately.
Yeah.
Yes. Can asthma be cured?
No, it cannot be cured. Well, we don't know of any cure for it. However, there are persons who, especially children, you develop asthma during childhood. And of course, a certain percentage of children will actually stop having symptoms like in their teens or in early adulthood. Okay. We don't really have an explanation for it, but it's something that is observed. A certain percentage, maybe as much as 40% of children who had asthma in childhood will actually stop having symptoms later on as adults. But in terms of say asthma is cured, it's not. Under the right circumstances, even in those persons who have not had any wheezes for years, under the right circumstances, they can reactivate. All right, so we always have to be on the guard where that is concerned.
But basically,
there's a point that I want to make in terms of treatment.
Yes.
In real severe cases, so we mentioned a person who is about to collapse, a person who getting drowsy and so on, what will happen is that their blood oxygen levels will start to fall because their lung is no longer functioning, and their carbon dioxide levels is rising to dangerous levels in the blood. So in that situation, what we actually have to do to save the life is to conduct what we call endotracheal intubation.
Yes.
So you have to give the patient something to sedate them or to make them sleep a little. Then you put a tube down into the trachea, through the mouth down into the trachea, so that you can actually help them to breathe. You connect them to a machine called a ventilator, and that will keep them alive until the asthma can be broken.
Wow.
So they will end up in the ICU, basically.
So asthma can be a really, really serious condition, eh? Life-threatening.
Yes, and people have died from it.
Yes.
You know, so.
Wow. Well, there you have it. Dr. Mac has told us all about asthma, and I see that the questions are coming in. So Dr. Mac, don't go anywhere, because after the break, we are going to go to naturopathic recommendations and your questions. So we'll go to the break and then come back.
The conference, in association with Portmore, Tent City, Gregory Park, Hellshire, and Brayton District of Churches, invites you to Countdown to the End Evangelistic Series with Evangelist Dr. Shian O'Connor, March 3 to 30, under the Big White Tent, Municipal Boulevard, Greater Portmore, St. Catherine, across from the JUTC Depot. Come hear dynamic preaching from Sundays to Wednesdays and Fridays at 7:15 nightly and 9:15 a.m. on Sabbaths. That's the Countdown to the End Evangelistic Series from March 3 to March 30. Come and be blessed. For more information, visit www.centralja.org.
All right.
The American Heart Association.
Welcome back. Now, can natural remedies help with asthma? Do you think so? Well, we're going to find out. Today we will hear, or this evening we will hear, the personal testimony of Nurse Camille Cahoon, I hope I got that correct, who suffered from severe persistent asthma, and how after radically changing her life, she has been asthma-free. Doc would say gone into dormancy for 4 years. So Camille, tell us, how did this all happen?
Okay, good night, everyone. So I am one of the nurses at Complete Healing Through the Laws of Health, and for most of my life I suffered from asthma and frequent hospitalization as a child, and asthma took me up into adulthood as a nurse. After I started a naturopathy program at Complete Healing, as you say, I have been asthma-free for 5 years.
Oh, 5.
And I have been exposed to the same triggers that used to cause my asthma attacks. One of the main things that we did, and that anyone can do when they're looking to do it naturally, is to have a consultation done. This revealed the areas that I needed to work on, and some of the main areas that was looked at: pure air, sunlight, temperance, rest, exercise, proper diet, the use of water, and developing a deeper devotion with God. So in my case, I remember my recommendations including me in ensuring that my environment was clean. Yes. And that was particularly important as a nurse, because sometimes you're exposed to chemicals that triggered off these asthma attacks. And I use the purifying plants to help with that, steaming with essential oils, and developing an exercise program to strengthen my lungs, practicing deep breathing exercises and techniques were some of the things that I did under that area. Going to bed early to promote health and rest so that my body can heal itself. I also use, in the form of supplements, vitamin D3, zinc, and magnesium. In relation to diet, I removed some of the hyperallergenic food from my diet, such as dairy, wheat, ripe bananas, bread. Yes, ripe banana is very hyperallergenic. What that means is that it can cause allergies. I
Mm-hmm.
bread and sugar from my diet, and I had my meals at set meal times. I developed a set meal times for breakfast and lunch, things like that. Increasing my water intake was important as well, up to 64 to 80 ounces of water daily was very important. When you're dehydrated, asthma, it's worse then. Let's just say that. So improving my water intake was very important.
So you,
Go ahead. Go
so
ahead.
you started increasing your water. You changed your diet. You eliminated some things. You had some breathing exercises. You said.
Yes.
What else? What did I miss?
You
go to bed early.
Yeah.
Of course, your connection with God, because nothing works without the Lord. So we understand that through Him, all things are possible. And He is the one that does the healing through these things that we take. So
that is so true. Another important thing was
quickly you see a change. How quickly did all of this start to show that something is happening, something is working?
Within 3 months. Within 3 months, I lost weight. I was breathing better. The changes really started within a month, but after 3 months, you could definitely see the changes. I was breathing better. I could do more exercise.
How frequent were your attacks?
Okay, so at the time I was practicing as a nurse, and we have a routine. You're exposed to certain triggers being in the hospital.
Yes.
And one of the things too, I was working in the operating theater. We had to be cleaning the operating theater at least, do a deep cleaning once every week, and you use chemicals and all of those things. So I would say my attacks were like 2-3 times for the month.
And after you changed
starting the program, I remember the first month after changing my diet, doing the consultation, I didn't really have an attack of such, but I had some tightness the first month. The second month I had no twinge, no tightness, nothing.
And by the third month, you were not having any attacks?
I was not having any symptoms at all. And I was breathing better, I was sleeping better. It was just amazing. And I have not had an attack since that time.
And you have kept to the change. You were consistent.
I have kept to the change. It is not something that I would wish upon anyone. And I believe that God designed.
When you say that, you mean the asthma, not the change.
Pardon me? The asthma, I would not wish asthma upon anyone. So I would not go back to what I used to do. That's what I'm saying.
Oh, praise the Lord. Thank you. Thank you. There you have it. You have heard a personal testimony. Somebody who was afflicted by asthma and for the last 5 years has been symptom free. I'm not going to say asthma free because Dr. Mack will tell me, no, that's not so, but has been symptom free. So we are saying with God, it's possible. Dr. Mack, please join us again because we have some questions here. Now, someone asks, can sinuses drain into the airwaves and cause asthma? Dr. Mack.
Okay. So that could be one of the cause of what they call nocturnal asthma, people who wheeze at nights. So I had mentioned GERD, but the sinus draining when you lay down, drain down the back of your throat, and because you're sleeping, you may not feel it there in order to cough it up before it gets down into the airways. So that can actually trigger asthma attacks as well. So yes, it can happen.
Can a very clean house? All right, let me see if I can figure out this. Can a clean house cause asthma when you're young? because the immune system wasn't exposed and they didn't play outside like in the old days?
That's a tough one. So this argument is used for, person being susceptible to infections in general, especially viral infections early on, because their immune system did not get to develop properly because they were not exposed to certain things in an early age. I'm not sure if it actually applies to asthma. I've not come across that in the literature. So I can say no, and I can say yeah.
But clean
what
house.
we know is that persons who are exposed at a young age, like in infancy and young children, if they're exposed to these triggers, then they actually can develop asthma as a result.
Okay. Okay. Another question: why is asthma so deadly?
Okay. So I guess it's because asthma, it affects your respiratory system, which is what regulates how you get oxygen in your lung into your body and eliminate carbon dioxide. Now, food, you can do without food for up to a month, sometimes even longer. Okay, if you ever hear about what's called a hunger strike, right? I forgot what the record is. Water, you can do without water for maybe a day or two. But oxygen, you cannot do without oxygen for more than a couple of minutes. All right?
Yes.
So when you have a severe attack of asthma and it cuts off your oxygen supply, you develop what we call hypoxia or hypoxemia. And that is why, especially in clear-skinned persons, you can see where the lips or the tongue turns blue or grayish. What's the color? That means that the oxygen in the blood is being used up and not being replenished. But also carbon dioxide plays a significant role as well, because the way you eliminate carbon dioxide from the body is by breathing it out. And if you're not able to do that, then carbon dioxide accumulates. And that is one of the things that causes your heart to race. It causes your blood pressure to go up. You develop cardiac arrhythmias and can actually get heart attacks and so on as a result. Right? So it affects both. So even though it's a respiratory condition, it can affect also the cardiovascular system. And that is why it is so deadly. That is why time is of the essence in terms of seeking treatment. Because if you wait too long, so it's not like when you have a belly pain, you can, you say, all right, I might go doctor tomorrow. No.
You have to deal with it. And no.
Yes, like no. All right.
Yes. Nurse, Cahoon, did you have a cold on your chest? I see somebody's here saying, why is there always a cold on my chest as an asthmatic? Did you have a cold on your chest?
If you're asthmatic, you generally have what you would call a cold on your chest. But what it is mucus in your airway.
So Dr. Mark, how we get rid of that mucus in the airway?
When you have an allergy, the mucus form along the lining of your airway to help trap whatever allergen there is, and so there. So that is what is referred to as the cold.
Yes.
So if you move away from your triggers or your allergens, then you won't have
that cold. Yes, it's not. Yeah, it's the body's defense mechanism during the allergic response.
Okay.
The body's way of protecting itself.
Yeah.
Oh, okay.
Yeah, so there are three main things that happen during an asthma attack. And if a person, sometimes even out of the asthma attack, they may persist at a lower level. So one is what you call a bronchoconstriction, which is the tightening or the narrowing of the airway.
Yes.
The airways, and they are surrounded by smooth muscle. All right. And that muscle helps regulate the size of the opening of the airway. So when you have an asthma attack, then it constricts and narrows the airway. But at the same time, the inflammation and exposure to the allergens or the irritants, because part of the allergic response is edema or swelling of the lining of the airway. Okay, so you have some cells that line the airway. So when they swell, because they're on the inside, so they will also help to close off the airway partially. Right? Yeah. And then the third thing now is the mucus. So you get increased mucus production. And sometimes, especially if the attack is going on for a while, can actually result in what they call plugging, mucus plugging. So they, with the breathing back and forth, they actually get dry, and then they form little plugs, block portions of the airway. All right, and that will cause your symptoms to become more severe as a result. Wow. So a person who is constantly having that sensation that there is something rattling there in the chest, they probably need to, you should see a doctor if you have not, because it means that the inflammatory component is not being addressed. Okay. As well as to check their environment to identify any of these triggers that they can avoid.
There's a question here. Can chest x-ray detect an asthmatic condition?
Mm-hmm. All right, so we do not normally rely on a chest x-ray to make the diagnosis of asthma. Most times when you do a chest x-ray, you're not going to see anything unless the asthma is being triggered by a respiratory infection, which can happen sometimes. You may see signs of the infection. Okay. As opposed to COPD, which we mentioned before, where they tend to get an inflation of the chest. So it's something that we refer to as a barrel chest. That is, so that's one way you can distinguish COPD from asthma. Yes. But asthma is an acute. When they present with acute attack, the focus is on breaking that attack immediately. So you don't wait. Sending a patient with an asthma attack for a chest X-ray would be a huge mistake. They can go to the X-ray department and collapse there and die. Yeah. So the focus immediately is on breaking that attack. You don't need an X-ray to do that. All right. So once they're stable,
airways immediately.
Then they can send for an X-ray after that. After they are stable.
All right. Wonderful. What is the name of that medication that the asthmatic should not be out of? Another question. I suppose somebody's talking about the one of the inhalers. I don't know.
All right. So so you have the reliever inhaler. That is usually a sympathetic agent like salbutamol, albuterol, and so on. All right. So what they do, they stimulate going into some physiology now, because the airways have receptors on them which respond to different chemicals which are circulating in the blood or by the nervous system. All right. So one of them is your beta receptors. All right. So when those are stimulated, they cause the areas to dilate. Okay. So that is what they use a beta agonist. So agonist is something that stimulates a receptor. So that is what is employed. So like salbutamol and albuterol and so on, that is what you have in the inhaler. Usually it's the blue one. Okay. And when you go to the hospital, it's a similar thing that will be used for nebulization, just at a higher dose. All right. The controller or the one that you use for maintenance to prevent the attacks. Usually it's a long-acting steroid. All right.
Okay.
So like betamethasone, dexamethasone, and they have some newer ones. I forgot the names. I don't know, but it's a steroid that is used. Some inhalers may actually have a combination. So the reliever medication they actually have long-acting versions of those as well, which can be combined with the steroid. So you have, for prevention, you have a combination of those two.
Okay. Nurse Kahuni, have you ever used a warm compress on the chest or anything like that when you're having an attack?
Yes. And that helps as well. Cold shower, warm compress on the chest, that can help with the breathing. It's like it helps to open the airways.
The cold shower does that?
Helps to open the airways. I normally do like what we call a contrast bath. So you do cold shower and a warm shower, or cold shower and a warm compress on your chest.
Okay, and that opens the airways.
It helps.
Okay. Doc, how should they use the inhaler? I remember there was this series on TV where the lady said the inhaler wasn't working, and when the doctor said, "Show me how to do it," she was squeezing it all over the place. So tell us, Doc, how do you use the inhaler the correct way?
I think that was house.
Yes, there you go.
Yes. Yes. So the proper use of the inhaler is really critical. You know.
Yes.
So like I said before, each time you press it, it delivers a set dose. So it comes out as a very fine mist, and so it's designed so that because if the particles in the mist are too large, they're going to fall out like in the mouth and in the throat. So it has to be fine enough for it to get down into the lungs when you inhale. All right, and so you hold it. Usually it's held upside down, and then you depress it. Most of them you depress it to activate it. So you put it in the mouth and with a seal around it. All right.
Right.
And you start to inhale. So you're gonna take a deep breath at the beginning of that deep breath. Not before, but as soon as you start the breathing, then you activate it so that the breath will carry it down into
the lungs. Okay.
The airways. All right.
Okay.
Some person may have a difficulty doing that. So what is recommended is that you use something that you call a spacer.
Yes.
A spacer is like a funnel-shaped tube that you attach the inhaler to, and you put that in your mouth, and so it makes it easier when you because you don't have to have such an issue with coordinating the breathing and the activation. All right, and especially in children, you should use a spacer. Okay.
Wonderful. All right. Dr. Douglas, I thank you so much for sharing the questions. Are there any more in the chat? Thank you so much, Dr. Douglas. Now, what an evening we have had. A mouthful, a whole house full of information on asthma. I want to thank you, Dr. McIntosh and Nurse Cahoon, for joining us and telling us, sharing your personal experience as a doctor, experience as a patient about asthma. Thank you so much.
Okay, and thank you for having me.
Right. So, family online, we thank you for your questions. We thank you for sharing. Remember to share the video. Thanks to our, of course, we said Dr. McIntosh and Nurse Cahoon for sharing with us. To our hard-working team, or one person, the team, Mishka May, thank you so much for being our tech support this evening. Family, we want you to join us again next week. Next week, Thursday, what time? 7:15 p.m. I know you know it. When we'll be focusing on prostate cancer. Can't afford to miss that. So you have a belly full from now until next week, Thursday, of asthma. So share the information that you have, share all that you have learned, and share the video as well. 3 John 2 says, Beloved, I wish above all things that thou mayest prosper and be in health, even as thy soul prospereth. It was my pleasure being with you this evening, talking asthma, and I hope that you have learned and you have also been blessed like I have been. God bless you, and until then, we'll see you next week.